This is Dr. Mark Cooper again, and today I'm going to continue my series on relaxation therapy and some strategies you might want to use to help with your chronic pain using some really psychological approaches. And please refer back to my initial evaluation on Jacobson's muscle tension relaxation approach, but today I'm going to talk about another strategy called Progressive Muscle Relaxation. And really this is you're using your mind to consciously let your body relax. And it's very similar to the muscle tension relaxation, but instead of tensing the muscle up first, you're just consciously letting each muscle group relax. And it's really easy to do, and it's really designed for people who have problems with muscles and joint problems, where you really can't tense the muscles up as much, but you can mentally learn to do that. And one thing that might be helpful is that you use, with this strategy, you might want to use a little essential oil. Like you can put a little essential oil like a frankincense, or maybe some lavender oil, or have it in a diffuser, and you can have that going on as a part of your strategy, and just the smell of that helps calm things down. But whatever essential oil you like, you can use to do that with. So I like, if you're going to do this one, I like for people just to, again, remember the steps. You want to get into a private room, maybe have a background noise going on, make sure family members and other people know that you're practicing, and this is a serious thing that you're trying to do, so don't get disturbed. Turn your cell phone off or move it in the other room, and just take maybe 10 minutes to practice this. And you probably ought to do it maybe once or twice a day until you really get good at it. And especially if you've got anxiety or phobias, you want to practice it when you're not having those experiences, so that you can use it when you do have one. Okay, so you get good at it. So the first step is just to feel the tension drawing out of your face, because that's where a lot of these muscles in your jaw and your neck, your shoulders, levator scapular muscles, and the scalene muscles here are all muscles of emotional expression. And so when there's stress involved, those muscles start firing, and you have a tendency to develop trigger points in those. So learning to relax those muscles is kind of important. So you take a deep breath, hold it for a second, and then relax and let it out in the count of 4. 4 going in, then 4 going out. And then you can close your eyes and imagine all the tension dropping out of your facial muscles. Just pay attention to your jaws and your face. Make sure your jaw is relaxed, your teeth are not touching, and there's no tension in your face. Focus on the forehead and make sure see all my wrinkles up here? See? You want to let those wrinkles just relax. Even though I haven't had Botox in them, just let them relax and calm down. And pay attention to that. It usually helps if you close your eyes. And pay attention to your neck. Just give yourself and let the muscles, pay attention to your swallowing. Make sure you're not having difficulty with that, and just kind of letting those muscles in your neck and just reach and drop down and relax. And then your shoulders hold a lot of tension. Most people do. That's where most people's headaches come from. It's up in here and here. So you just want to make sure you're not holding yourself tense. You just let your shoulders drop down in a relaxed position, and maybe put your hands down. And when you do that, you might feel a little tingling in your fingers. Okay, because sometimes when people are holding the tension so long and they let it relax, you get some tingling in the fingertips, in the fingertips. So don't worry about that. That sometimes happens. Just let it drop and let them hang, maybe in your lap and relaxed. And then go to your stomach and just pay attention to your stomach and let those muscles relax. And your chest. Then you move it, so you're moving down your body. Then go to your low back. Then your buttocks. And, you know, think about those muscles. Think about you're getting the improved circulation to them. If you can visualize blood going in and blood going out, you know, and bringing in oxygen and circulation, that all is helpful to you. And then pay attention to your buttocks and the thighs and your legs. Then work down to your calf muscles. And sometimes even with this progressive muscle relaxation, I just have people just kind of move that muscle just a tiny bit, not tense it up like in the previous demonstration where you really tighten it real tight, but just kind of move it just a little bit. Sometimes just a little tiny movement is enough to help you recognizing that muscle's tense, and then let it relax a little bit deeper. And then pay attention to your ankles. And again, sometimes you're just kind of moving your feet just a little bit to side, where you just, you know, move your ankles this way or maybe back and forth a little bit. And then let them just sort of relax. And then look at your toes. You can just kind of wiggle your toes just slightly, or just let them pay attention to the tension all draining out of them. And then just kind of relax like that. And then go into the deep breathing technique where you take a deep breath, hold it for 4 counts, and then breathe out for 4 counts. There you go. That's pretty good. And if you can do that, it can help take the tension out, and it gives your mind something to focus on. So you're focused on each body part, one step at a time, and relaxing. You probably want to go through, you may have to go through this sequence 2 to 3 times, but the more often you practice this in the same environment, the quicker you'll be able to get to that relaxed position and relaxed stance. And, you know, at the same time, see, your mind is focusing on this relaxation activity rather than what you're worried on or your pain. Okay? So I hope you found this helpful, and thank you again for watching, and God bless you.